So you have constructed your nursing care plan for our patient in this scenario. And so let's go ahead and review that. Okay, so what nursing diagnosis did you all come up with?
Well, she has impaired physical mobility related to decreased motor function and left-sided muscular weakness as evidenced by inability to bear weight on the left leg.
Okay, so exactly what do you mean by decreased motor function?
She's unable to move normally.
Well, in our scenario, if you look back on the scenario, she had a stroke 3 days ago. So the decreased motor function is in relation to the stroke, right? Okay, and so out of that, we know that she had the left-sided muscular weakness, which we got that as part of your role, the data that was collected, and then also the inability to bear weight on that left leg, right? Okay, good. So then that's our nursing diagnosis. So that's our problem, impaired physical mobility. So then the goal, what would be a good measurable goal that you guys came up with?
Our goal was that the patient will walk to the end of the hall using walker by discharge.
Okay, and so is that indeed a measurable goal?
It would be because we could actually see her do it. I could physically see her walk down the hall.
Okay, yeah. Does anybody else have anything to add? Okay, so yeah, you can actually physically watch her walk down the hall, right? And so that is measurable because in nursing, when we have our problems in our nursing diagnosis, we have to make sure that these goals are measurable and they're realistic as well. So would you say that it's a realistic goal for our patient that has a stroke?
Yeah, I think so.
You think so? So she's getting physical therapy, right? And so because of that, that should help her reach this goal. Now, another aspect of the goal, what's the other aspect of the goal? We know that it needs to be measurable, but what else? What else do we have to have as part of our goal?
It has to be in a certain time frame.
A certain time frame. Very good, Jackie. So it has to be a certain time frame. And so your guys' time frame for this goal is?
By discharge.
By discharge. Okay, and sometimes in nursing, we do see that. Sometimes we have maybe within 3 days, a goal will be achievable, okay? But I do think with this scenario, having it by discharge is a very good goal for our patient. So then we have our problem, we have our goal, and so the nursing intervention. What are the nursing interventions? Why do we do nursing interventions? What do you think?
That way we could help them, like encourage them.
Yeah, it's the nursing care that we provide for our patients, right? Okay, and the nursing interventions are specific to achieve what? Towards that?
The goal.
The goal. Very good. Okay, so your assignment was to have 3 interventions, so you guys figured out the 3. And what did you come up with?
Our first one, we did assist patient in walking with walker in room 3 times per day.
Okay, assist patient in walking with walker in room 3 times per day.
Yeah.
So what was the reason why, what's the rationale behind that?
The reason why we chose to do that is because we could help her in case she was to fall or like to be kind of wobbly, and then also we could help encourage her to push a little harder so she could. So we could achieve our goal faster.
Okay, so you assist the patient because providing assistance is going to help prevent falls, and that's the last thing we want is our patient to fall. Okay, so what was your second intervention?
Encourage to walk with walker in hall at least once daily, and then we could assist her if that was needed.
Okay, so, and your rationale behind that one?
We want her encouraged to do it because that would motivate her and provides motivation to her.
Very good, yeah. Encouragement is great. We always want to provide encouragement for our patients because they don't want to be in the hospital. They want to go home as fast as possible. So we want to encourage our patients with that. So very good. And then your third one, what did you get for the third one?
Reinforce instructions from physical therapists for exercises and walker use.
Reinforce instructions for what? I'm sorry?
From physical therapists for exercises and walker use.
Okay, all right. And so what was the rationale behind that intervention?
Well, if we reinforce the instructions for her, it's going to help her to remember them, to remember to do it. And
Okay, and so you're reinforcing instruction from the physical therapist. So as a nurse, it's going to be important that you communicate with the physical therapist, right? So that we know what they're doing for the patient, and then we can go ahead and follow up with that. Because we do want to reinforce what other disciplines are doing for the patient as well. Okay, so very good. So any of you have any questions? Did you find that you had a little bit better understanding of the whole nursing process? Pretty much. But we'll keep doing, you know, more patient scenarios as we meet. We'll probably do another one next week when we meet again, so that you guys have a really good understanding of it. So you ready for your quiz?
Yeah.
All right.